To figure out the day's activities. How fast are you able to do that? How efficiently can you kind of go through the day in your mind? Or do you find that it's becoming more difficult and it's because you're under a lot of stress? By the way, folks, these are the same kinds of problems that we faced when we were parents. You know, when our children were young and we're trying to stay on top of their school schedules and their athletic schedules and whatnot. Very same process, but under different circumstances because we're now older, right? Delayed verbal recall. This is referring to short-term memory. Delayed short-term verbal memory. Yes, all of us will face CRS as we get older. Anybody know what CRS is? Can't remember stuff. Yeah. Can't remember stuff. Okay. We all experience that as a normal part of getting older. Even I'm experiencing that. But what we're talking about here is a very specified type of short-term verbal memory. And think again back to what I described a few moments ago about cortisol levels as an example, and sleep impairment and so forth. It's affecting our ability to hang on to verbal information for a longer period of time. Okay? Executive function, our ability to coordinate information, organize it, formulate a plan of action, all of that is considered to be executive function, and that happens more, not exclusively, but a little bit more loaded in the front part of the brain, what we call the frontal lobe of the brain. That's where a lot of executive function occurs. And once again, that can be affected. It's not going to be affected the same way each one of us here is different, okay? So we're not going to be affected the same way, but these are the factors that can load into our own experience of caregiving problems. We have to look at, just a variety of individual differences, unique characteristics for each of us, that will place us at greater or less risk of developing these types of problems. Okay. So let's shift gears and look for a little bit here at just the psychological factors that are kind of the outgrowth or the aftermath of some of these other types of processes. Start with depression. Those of us who are caregivers are at a 30 to 80% rate of developing depression versus the general population over the age of 55 who have a 6 to 9% rate. That's more of what we consider the normal prevalence rate of the development of depression over the age of 55. But if we're caregivers, our risk is higher, considerably higher as a matter of fact. It's well worth keeping in mind because it will affect our ability to adequately provide care. Related to that is anxiety. Anxiety is a biggie. Especially, and this is through actually a cancer caregiving study that was done in 2000, I think just last year. It was just published a month or two ago. There's an increased risk actually of developing generalized anxiety disorder as a result of caregiving stress. So depression and anxiety, two of the real big things that we need to consider as caregivers. We would love to be Supermen, Superwomen, Wonder Women, whatever, okay? But we're not. We're human. And we are going to encounter challenges that we're going to have to deal with and work with for ourselves too. Let me ask this though, as we consider these types of issues, depression and anxiety, what are some of the specific reasons why that might happen? What are the specific issues that cause a caregiver to feel depressed or anxious? Isolation. Yes. What else? Holler them out a little louder. I can't hear them up here.
They said that they won't mind.
They won't mind. Okay. Yeah. What else? Factors that cause us to feel depressed or anxious. Coping with health issues, yes. Seeing our loved one or the person that we're caring for dealing with major health issues and actually having to, in many cases, to provide direct assistance with some of those, which we never expected to do before. Changing a catheter, really? Did we ever expect to do that with our spouse or with our aunt or uncle or whomever? As an example. Yeah. What else? Uncooperative family members. Yeah. Can cause a lot of frustration as well as depression, anxiety, and the like. What else? Sorry? Financial burden. Very, very big. Can cause a lot of anxiety, even some depression. What else?
Loss of dreams.
Loss of dreams. Wow. Yeah, that's a biggie. A loss of dreams. You know, the things that you thought you were going to be able to do and you're just not going to be able to do them. You know, my mother developed Alzheimer's disease, an early onset Alzheimer's disease at the age of 62. The first time that we children started noticing this was at our father's retirement, when he retired, and they were going through some festivities and the like. They really were essentially robbed of the dreams that they had for their retirement. That's big. It caused especially my father, a fair amount of anxiety and depression. What else?
Watching them suffer.
Watching them suffer, yeah. Even those of us who are professional caregivers struggle with that one. It's not fun. It's not pleasant. We all know this. Not pleasant. And yet, it's necessary. Right? We have to, somebody has to provide care. What else? Any other factors? You don't see an end. It's open-ended. It's like, when is this going to end? Yeah. Oh, that's a big one.
Quite often there's emotional connection between the caregiver and the patient or family.
Emotional connection. And what's happening with that connection? Sorry? It's changing. Yeah, and in a very real sense, you're losing that person before they even passed away, right? Yeah, so you end up going through the mourning process before that person passes away in many cases, in most cases. Not easy. Causes a lot of depression, it causes a lot of anxiety, and even anger. Yes?
Well, I have one, she's 100, but every time I go to see her, she hopes she's dead by when I come back. But she's 100 years old. So that's very hard. She's very depressed because she really wants to die.
Yeah, a woman who is 100 years old, and every time that this lady visits with her, this 100-year-old wants to just say, well, I'm hoping this is our last visit. I'm hoping I'll be dead by the next time you come over and to see me. Yeah, and that can be stressful. That can be stressful on the caregiver as well as the individual. Yeah.
I have one that has no family, none.
No family at all.
And all she wants to do is vent, and let her vent.
You let her vent because she has no family of her own, and so she's dealing. So you're actually, in a sense, becoming a counselor then in that sense, and you're letting her vent, and that can be stressful on us as caregivers too. Yeah, I mean that can pull us down too. It takes a special measure of giftedness in just about any profession to do the job you do, and that's true with counseling as well. And yet, most of us, at one time or another in our life, are going to be pulled into a counseling relationship, as it were, to some extent or another. All right, that would be an example of it. And many of us are just simply, that's not our area of giftedness. Okay, and there's nothing wrong with that. It's just, it is what it is because we're in that situation, right? And so, yes, that can also tend to challenge us and pull us down. Here's another one that we haven't talked about yet, and I wanted to just briefly throw this one up there. Behavioral disturbance. The actual behavioral disturbance of the individual, the care recipient, can actually have a bearing on caregiver stress. This was from a study that was just published last year by Liu and Company. And what they found is that folks who had frontotemporal lobar degeneration, or if they had Lewy body disease, exhibit more what we call neuropsychiatric problems than Alzheimer's patients do. Now, these types of problems particularly for like dementia with Lewy bodies, include things like hallucinations, delusions, Parkinsonism, greater measures of sleep disorders. Frontotemporal problems include things like apathy, language impairment, behavioral disinhibition, somebody whose filter comes off, and they were the most wonderful, kind individual, become just completely unmanageable. Their behavior just goes out the window. These types of behavioral issues will have a bearing on the individual who is providing the care. And the conclusion from the study was that the increased frequency and severity of these types of behavioral disturbances will increase the level of caregiver burden and stress. So think about the situation or situations that you are in as a caregiver. The individual you're working with, they may have Alzheimer's, they may have a vascular neurocognitive disorder, vascular dementia. Technically, by the way, folks, we're now calling it neurocognitive disorder, so if I ever use the term neurocognitive disorder, it's basically the same thing as dementia. But dementia was considered politically incorrect, so they changed it. I digress. Okay. But anyway, think about your own situation for a second. And think about what the diagnosis is for this individual that you're caring for. That will have a bearing on this picture. Okay? So there are some implications of all this. Behavioral disturbance of the individual and the stress level that we as providers or caregivers are under means that caregivers are going to require different levels of support based upon the diagnosis received by the care recipient. This is not a one-size-fits-all proposition. So if, for example, you and many of you are working with, you're working with, what organization is this? Senior Companions, thank you. I'm still learning these things in this area. I just moved here 3 years ago myself. So what you're encountering then, when you're caring for somebody with Alzheimer's disease, for example, is probably going to be stressful, but it may not be quite as stressful as if you're working with somebody who has a Lewy body dementia or something along those lines, Lewy body disease. Okay, so that can also kind of give us a better sense of the level of support that we as caregivers will need or require. Additionally, with sufficient knowledge and understanding of the disease or the disorder that this person that we're caring for has, our resilience can actually increase. Our ability to manage that care for that individual, our ability to roll with the punches, as it were, can be enhanced simply by learning more about what we are dealing with. So many times in my clinical practice, I sat across from somebody who was, and I had tested somebody who was encountering a significant cognitive problem, and their family members were sitting there. And I was oftentimes, not always, but oftentimes one of the first to actually render a diagnosis, all right? Physicians would send an individual to me and say, please help me identify what's going on here. Is this an Alzheimer's or is this something else, or what's happening? 90% of the time, when I would provide a diagnosis and say, this is what it is, I could visibly see a sense of relief coming across the face of the caregivers, and sometimes even the individual, because they now know that there was really a problem, and they now have a name for it. Even that by itself can be huge. Now let's consider that a little bit further. As providers, and there are only a handful of us in here, but as medical providers or providers of any kind of care at a professional level, then, we should be paying attention then not only to the needs of the patient, but also to the needs of the caregivers. right? So caregivers need just as much support as the patient does when dealing with these kinds of matters. But how often does this really happen? And also, what prevents this from happening on a more consistent basis? Why is it that when we go in, we take our care recipient into the doctor, for example, the doctor really doesn't give us as much information as we probably want or need? Why? Anybody? They don't want to be the bearer of bad news. That's often the case. That's why I often got stuck with it, kind of like, hey, go ahead and handle that one for me. Well, okay, somebody has to. So that's one. They don't want to be the bearer of bad news. What else gets in the way of a physician, for example, or a nurse practitioner? What's that? HIPAA, yeah. HIPAA, a federal standard. That one can be worked around because of maybe this person's need for, formal activation of power of attorney or whatever. But yeah, HIPAA can be a big part of that process. What else?
I would figure that you don't totally understand what's going on.
Ah, you don't understand what's going on, so why burden you with a bunch of medical gobbledygook that isn't going to make any sense? Yeah, I just had this discussion with a class, a health psychology class, about a month ago. It was fascinating to see these students' light bulbs go on. It's like, oh, yeah. And there were several in that room who are going into medicine or going into physical or occupational therapy or social work. And I said, try never to go that route. Try never to just draw the conclusion that you can't explain enough to this individual and this individual's family or the caregivers to help them ease their own stress. Another one. How about health insurance itself? How much time is your physician or your nurse practitioner able to spend with you and your loved one? Not much, and it's getting less. And it's all due to the way that health insurance reimbursement occurs. Essentially, physicians are being paid more to do less, as it were, to spend less time so they can actually see more people. Okay? And if they spend more time with an individual, that means that their efficiency is down, and through government regulations, that is going to reduce the amount of income that they receive. That's a crazy system, folks. It's one of the reasons why I think I was let out of it, that system 3 years ago. I was independently practicing, and it was becoming extremely burdensome for me, too, to try and operate in that kind of a system. Very difficult. So we've got several things going on here that get in the way. You know what? There have been studies done on this. There was a study already back in 2012. This was before the advent of Obamacare and the associated Medicare regulations that came with that. And this particular study showed that informal caregivers, that would be those of us who are family members or friends or whatnot, often receive inadequate support from our healthcare professionals. Hey, we've got documentation of this. It's not just all subjective here. Moreover, informal caregivers often feel abandoned and unrecognized by the healthcare system. Wow. That is pretty indicting, I think. Something we need to consider. Everybody is under the gun on this one. It isn't a matter necessarily of just a provider, like a physician or a nurse or a social worker or whatever, not wanting to spend the time. But not being able to spend the time is probably the greater issue. Now, there are exceptions, and yes, there are times when a physician or a nurse practitioner or whatever doesn't really want to be the bearer of bad tidings, or they do kind of draw the erroneous conclusion that they won't be able to explain this sufficiently, so why try? But by and large, I would hazard a guess that it has more to do with the regulatory environment, the healthcare system that we're encountering. If I might, on the side here, that I referenced a class, a health psychology class that I was teaching this spring. At the very end of that semester, just a handful of weeks ago, we had a lengthy discussion over the course of a couple of days about healthcare issues and health insurance and the state of what's happening in our country. And I looked at these individuals in the room who were considerably younger than all of us here. All right? These were people who were somewhere between 20 and 23 years of age. And I said, you are the generation who's going to need to fix this. I'm sorry you have to, but you have to. Otherwise, it's just going to get worse. I said, please think about that now so that you can begin preparing for the challenges that you're going to face and the job that you're going to have in trying to fix this problem. So, for many of us in here, it might not happen in our lifetime. Maybe it will. But we can always look toward that. So let's talk more very practically here. What can be done to reduce caregiver burden? I'm going to start by looking just briefly at medical providers, professional providers, and what professional providers can do then to reduce caregiver burden. And then we're going to talk about informal caregivers as well. But I think even for you informal caregivers, recognize that a lot of these are going to also apply. Because many of you, especially those of you who have been, let's call you seasoned volunteers, you've been through this before, you kind of have an idea of what's happening, and in a sense, you are becoming a little bit more of a medical provider in that sense. So you will be able to also work with some of these principles and some of these ideas. First and foremost, draw the caregiver into the care team. That means that when Richard comes into the room with his wife who's providing care, you also address the needs of his wife. You at least start working with the wife as well and try and provide information. Okay? Try and encourage that caregiver to maintain self-care, to maintain their own health and well-being. That's going to be huge. Also providing education and information about the needs of this individual, about Richard, using that example. Education and information is huge. It's been said that information is power. It really is when it comes to knowing and understanding what your loved one or what your care recipient is going through. Just understanding that. And the medical provider is in a great position to provide that information if they take the time to do so. Also, medical providers can encourage the use of supporting technology. Supporting technology has to do with using any kind of technological advances that we have right now in the better interest of providing care for this person. Example, just a couple days ago, I have a copy of it here, a couple days ago there was an article online about the use of Amazon's Alexa for providing care, or for this individual who has some type of medical or cognitive problems, being able to use Alexa to access certain types of information, and that reduces what's going on with the caregiver and what the caregiver is going to have to provide. Think of the use of telehealth. Anybody in here involved at all with telehealth? Or a couple of you. Anybody in here not know what telehealth is? Okay, let me explain telehealth. I think it's going to be relevant for each and every one of us here. Particularly in a rural area like this, we are now able to provide certain types of medical care and even certain types of psychiatric care and psychological care through the internet. So we set up like a Skype call, as it were. A provider, like a doctor with a patient. And they can actually see you, it's a video call, okay? They can actually assess what's going on, and if you have a wart on your arm and you tell him about the wart, he'll say, okay, take the camera and show me, or put that in front of you. This is happening. Matter of fact, in the hospitals around here, the hospital systems here, Vera and Sanford, in the emergency departments, if you're ever in there, you're going to see a camera up in the corner, mounted in the corner of the room, and a microphone hanging from the ceiling. They can actually telehealth in somebody, an expert or a specialist, from Sioux Falls or Sioux City, get them involved through a video feed. That's telehealth. Now, there are a lot of implications of telehealth, and we won't go to those right now, but technology doesn't have to be our enemy. It can be our friend. Medical providers can encourage the appropriate use of and the judicious use of these types of technologies. 5, coordinate and refer care for care assistance. In other words, help the care provider to get the help that they might need if they're experiencing depression or anxiety or something. Also, encourage the use of respite care. Each and every one of us needs a break. That's why tomorrow I'm leaving for Alaska, okay? All right, yes. Yeah. We all need a break. Even those of us who may be spouses, caring for a loved one, we still need breaks. It's important, it's necessary to take those. It's necessary to arrange for respite care in one form or another. But medical providers can encourage that as well. All right, let's talk briefly about caregivers. You, as informal caregivers, what can you do? Well, some of these are going to be the kind of flip side of what we just talked about. The first one is this: proactively and assertively seek to be included in the treatment team, in the care team. So when you're talking with your loved one's physician or your charge's physician, or you're talking with a nurse practitioner, or you're talking with a medical social worker, or whatever it might be, recognize that you need to be assertive with them as well and ask to be included